With going back to school, do you think that's a good idea? And should they have to social distance and wear masks? And also, like, a lot of people are saying that these kids go back to school, maybe they won't die from it, but they're going to come back home and infect grandma with the virus.
Sure. So let's talk about the kids first of all. We know that the kids are relatively immune from this virus. In Orange County, where I live, you can count the number of deaths on, actually, you don't even need any hands to count the number of deaths in children because it's been zero. Across the country, the number of deaths in children have been very, very small. I think it's maybe 30 or 40 now. To calculate the fatality rate, you can't even do it. There's so many zeros after the decimal point. Again, they have a much greater risk of dying driving to school than they do of COVID-19. So it's clear that children aren't at risk. What they are at risk from is delaying their education, from delaying their socialization, from keeping them home and therefore keeping parents who work home as well. That's a greater risk. Now, the question of could kids be an asymptomatic carrier and then spread it to an at-risk teacher? Very unlikely. There's almost no scientific evidence that the main transmission vector is asymptomatic children giving it to adults. That's just not a thing. And if we're worried about teachers, then let's find a way to protect the teachers like we would with that cancer patient. We don't create protection, build a wall around that cancer patient by having the neighborhood wear masks. What we do is we protect that individual. And there's ways to do that. Maybe, just maybe, a teacher might want to socially distance, not be hugging kids, stay further away because distance is a key to infection. Maybe we even treat that teacher, if they're at high risk, preventatively so they don't get ill if they were to be exposed to the virus. But putting masks on school children not only is not unnecessary, but I think it's very unhealthful to do that.
What is the issue with having your mask on and breathing your own CO2? Isn't that a bad thing to do?
You know, we did an experiment in my office. We have fitness trainers in my office. They're super healthy and very fit. And I check their pulse ox, a little oxygenation meter that you put on the finger that measures blood oxygenation. At rest, it should be around 98%, and on these two ladies, it was. Then we had them on a treadmill, walking briskly for a couple minutes, recheck their oxygenation in the same ballpark. Then I put a mask. One wore a surgical mask, and one wore one of those homemade cloth masks. We had them, again, walk briskly on a treadmill for a few minutes. Oxygenation meter back on them. Both of them had significant drops in their oxygenation. One as low as 79%, and the other one was in the mid-80s. So for a healthy person over a short period of time, probably not a problem. But to have somebody who's not fit, wearing a mask, exercising with a mask on, that's crazy town, and it's very unhealthy to do that. Not only that, after you've been breathing on that mask for 5 or 8 or 10 minutes, it gets really moist inside. And once that mask is moist, the ability of that mask to filter goes out the door. So its ability to filter viruses and other particles when it's wet drops precipitously. And so if you looked at a visual of the size of a coronavirus versus the size of the filtering ability of a mask, it's like the equivalent of building a chain link fence to try to keep out mosquitoes. That's the size differential. So although the virus can travel in droplets and the masks can somewhat collect those droplets and prevent those droplets from going out, there's still a very imperfect mechanism to try to prevent the virus spread. And we have studies with influenza and the common cold that says they just don't work.
I always find it very funny when I'm walking my dog in my apartment complex, and there's people just by themselves running with their masks on.
It makes no sense.
I'm like, you can't breathe, man.
And there's gyms that have opened back up, although I understand they're now going to be closing, where they require people to wear masks. You have people on treadmills and various machines breathing hard and exercising with a mask on. Very unhealthy, in my opinion.
Yeah.
By the way, you want the good news or you want the bad news?
I want the bad news.
The bad news is you don't have any immune antibodies, so technically you're still susceptible.
Oh, it came?
Oh, yeah. So if we look at this, you see a little line next to the C. That's the control line, which means it worked. There is no line next to the G, that's IgG or memory antibodies, and there is no line next to the M, the IgM line, means you don't have any acute or active antibodies right now. So this is considered a negative test. which means technically you're still susceptible, although you're young, and I really wouldn't worry if you caught the virus.
So I did this pain on my finger for absolutely nothing.
You suffered for the good of the people that are watching this video.
Yeah, that's exactly what it's for. My pain is your guys', you guys love that.
Exactly.
But let's talk about just going into I don't want to spend too much time on this, but just, we were talking before about how you had hydroxychloroquine that you subscribed or prescribed to some patients, and you got some calls. What is the deal with this?
You know, we were talking before we went live, and I literally got a text from the pharmacy that said they are refusing to dispense my prescription for hydroxychloroquine. Just yesterday, a patient with very mild symptoms that tested positive for COVID-19. I wanted to treat hydroxychloroquine, Z-Pak, and zinc. Makes perfect sense. The research and the studies are showing that for mild and early disease, it works wonderfully well. So the pharmacy called me up. Hello, Dr. Barke. I need to know why you're prescribing hydroxychloroquine. By the way, hydroxychloroquine is not a restricted drug. It's not like I'm prescribing OxyContin or Vicodin, where a phone call to verify the prescription would be appropriate. This is a non-restricted drug. It's been around since the late 1950s. There are literally, as you and I speak here, millions of people around the country, around the world, that take hydroxychloroquine for their rheumatoid arthritis, for systemic lupus. I would prescribe it routinely if you were going overseas to Africa to an animal park where they have malaria. I would prescribe it to prevent a malaria. It's very, very safe, and I believe effective early on at treating COVID-19. But yet here I am challenged for the first time in my 30-plus career in medicine on a prescription that is otherwise perfectly safe. A pharmacist calls and wants to know why. What did I say? Thanks for asking. I said, none of your business. This is between me and the patient. Just like I prescribe other medications, I would respectfully ask that you fill the prescription and not challenge me on my prescription. So that was my response. Ultimately, she backed down and said, okay, Dr. Barke, I'm just sorry. I've been told that I'm supposed to call and verify. And ultimately, they prescribed. But today, now, a pharmacist is refusing to prescribe, so we're now having to find a different pharmacy that is willing to dispense the product. It's ridiculous. It's crazy town right now, what's going on.
Yeah, I know. I want to end it on this, that, you know, you're just talking about how it's crazy town right now in America, closing down the country again, even with all the data, supporting other avenues. What is the truth and what is political about this? What are the things that we actually know that we can all agree on? And what are the things that have been totally politicized by this?
You know, that's a great question. And I follow Dennis Prager's motto, and that is first tell the truth and then give your opinion. And I try to do that in my blog posts. As a matter of fact, I'm writing a book as we speak, COVID-19, My Prescription for Liberty. And it highlights some of those myths that are coming out about COVID. So what are the truths? It's a dangerous virus. It's very contagious. It's dangerous if you're susceptible and you live in a nursing home or an extended care facility, or you have significant underlying medical problems. It's a dangerous virus. A lot of people have died from this. If you're a young person, though, it's not dangerous and it shouldn't be feared. We can't live our life with fear. We need to live our life fully with information and with mitigated risk. So that's the truth. And there's a lot of opinions and a lot of misinformation, a lot of fear-mongering on the media. My advice is turn off the TV. You know, you can read the CDC website that has a lot of good statistics. You can certainly follow my blog and my posts as well. I try to differentiate between a fact and statistics that I give and my opinions on those facts as well. But it's important to not live your life with fear and get about your life and mitigate risk. If you get sick, you get sick. If you're a young person, I'm not worried. Find a doctor that understands this, that's willing to treat you if you were to get sick, and you should be just fine.
My hand is healed now. I can shake your hand. Thank you so much, Dr. Jeff Barke. We really appreciate having you here. Where can people find you?
So you can find me on Instagram at RX for Liberty, RXFOR Liberty. Certainly you can find me on Facebook, Jeffrey Barke, B like boy, ARKE, or in the Twitter cesspool at RX_for Liberty.
Thank you so much. I really appreciate you guys watching this video. Get the truth out there. Share this video with your friends. Comment your thoughts down below on what you learned. We're going to see you guys in the next one. Thank you.